For families facing a deadly brain cancer, scientific progress can't come soon enough. Tonight, we compilate the story of Ethan White, but we will highlight the science that is breaking the old one-year death sentence for children and teens. Ethan was a drum practice student at the University of Michigan marching band when he first noticed his right hand no longer felt the drumstick. Weeks later he tripped upstairs, and the campus health service directed him to a neurologist. In March 2024, Ethan received a diagnosis that echoed the worst of pediatric oncology: diffuse midline glioma, or DMG, an aggressive brain tumor that has historically left an estimated one-year survival window. DMG has long been the deadliest pediatric cancer. Previous treatments like radiation could only temporarily slow tumor growth and ease symptoms such as weakness or double vision, but they did not alter the inevitable outcome. That grim record is beginning to be challenged. Over the last several years, researchers have identified a genetic mutation common to many DMG cases. By targeting this mutation, scientists are experimenting with therapies that can slow the disease progression. Though a cure is still far away, the progress is tangible. For the first time, we don't get zero survival, says Dr. Sabine Muller, director of the Pediatric Brain Tumor Center at UCSF. Her words bulb a sense of hope that was missing before. Personal stories underscore the urgency of such scientific strides. Jen Janasco, once a pediatric oncology nurse, lost her 5-year-old daughter Izzy to DMG last year. Jen recalls the doctor's words at diagnosis: "It was a death sentence." Now, Izzy is participating in a clinical trial using CAR T-cell therapy, where a patient's immune cells are reprogrammed to attack cancer. Jen's experience illustrates how each case can inspire research that may save others. DMG is sometimes called diffuse intrinsic pontine glioma, DIPG, when it affects the pontine region. The disease typically strikes children between the ages of 5 and 15, with about 500 new cases reported nationwide annually. Early signs include double vision, one-sided weakness or facial drooping, and may come with headaches or vomiting. Within a year of diagnosis, most patients lose motor function and develop speech and swallowing difficulties. In the final stages, patients can become severely paralyzed and non-communicative. While no definitive cure exists, incremental advances are evolving. The combined force of genetics research, targeted therapy trials, and innovative approaches like CAR T-cell therapy are creating a new frontier. Each breakthrough reduces the timeline from a fatal diagnosis to a living again. Parents and clinicians now have a reason to stay hopeful and push for further research. If you want to learn more about how science is reshaping outcomes for children with DMG, keep following this channel. Thank you for listening.